"You've done outstanding work," Dr. Patricia Carmichael said, sliding a small gift box across her mahogany desk. Inside was a spa day voucher for $300, a token for someone who'd just saved her pharmaceutical company from FDA shutdown. Patricia was 59, with the kind of polished appearance that comes from personal stylists and regular Botox appointments. Her cream Chanel suit probably cost $8,000. Her office had floor-to-ceiling windows overlooking the Charles River in Boston. She wore pearls that looked like they'd been passed down through generations of old money. I sat in the leather chair across from her. My hands rested on my briefcase. I didn't smile. I didn't reach for the gift box. After 18 years in pharmaceutical compliance, you learn that politeness is just a prelude to betrayal. What Patricia didn't know was that every regulatory compliance system her company used was licensed from my consulting firm, and in about 12 hours, her entire operation was going to learn what happens when you replace the compliance director with the chairman's niece. I'm Dr. Sarah Okonkwo. I'm Director of Regulatory Affairs and Compliance, which means I'm the person who keeps pharmaceutical companies from being shut down by the FDA. My job is navigating the intersection of medicine, law, and federal bureaucracy so that drugs can actually reach patients. For 17 years, I've been the invisible guardian between pharmaceutical companies and regulatory disaster. The headquarters of Nexus Therapeutics smells like industrial air freshener and the faint chemical tang of nearby laboratories. It's a glass and steel complex in Cambridge. All open floor plans and motivational posters about innovation. While the research scientists upstairs discover new molecules, I'm 2 floors down in regulatory affairs, making sure we can actually sell them. When I arrived at Nexus 19 months ago, the company was 6 weeks from losing FDA approval for their flagship drug. Their previous compliance chief had resigned after a manufacturing inspection revealed systematic documentation failures. The FDA had issued a warning letter. The agency was threatening to halt production at their main facility. Patricia was facing potential criminal referral. The company's stock had dropped 63% in 8 days. I didn't just fix the compliance violations. I rebuilt their entire regulatory infrastructure from foundation to submission. But I was careful about how I did it. I created the entire compliance management system through my firm, Okonkwo Regulatory Solutions. I licensed it to Nexus under a professional services agreement that granted them operational access but not ownership. The contract contained a provision buried in the technical specifications. Schedule C, Paragraph 8, Regulatory Integrity Clause. If my position as Director of Regulatory Affairs was terminated or materially restructured without 90 days written notice and mutual agreement, I retained the right to suspend system access pending regulatory review. In simple terms, if they fired me or diminished my authority, I could lock them out of their own compliance systems. Over the next year, I integrated that infrastructure into every aspect of Nexus's regulatory operations, FDA submission management, clinical trial documentation, manufacturing quality records, adverse event reporting, post-market surveillance, inspection readiness protocols. Everything ran through systems I controlled, and it worked extraordinarily well. Within 9 months, the FDA lifted the warning letter. We passed 3 separate unannounced inspections with 0 findings. Our drug approval rate improved from 47% to 91%. We launched 4 new products without regulatory delays. Revenue increased from $460 million to $820 million. Patricia was named one of Boston Business Journal's most influential healthcare leaders. But Patricia wasn't just a CEO. She was Dr. Patricia Carmichael, descendant of the Carmichael family that had owned hospitals throughout New England for 3 generations. Her father had founded Nexus 38 years ago. Her brother ran their European division. Her niece Amanda was being positioned as the next generation of leadership. Amanda Carmichael arrived at Nexus 13 months ago with an MBA from Columbia and a master's in public health from Johns Hopkins. She'd never worked in regulatory affairs. She'd never managed an FDA submission. She'd never sat through a federal inspection. But she had credentials. She wore designer suits and jewel tones that photographed beautifully. She spoke fluently about patient-centered outcomes and regulatory innovation in stakeholder meetings, using phrases she'd absorbed from consulting reports. Her confidence was inherited, the kind that comes from never having to prove yourself in an industry that eats the unprepared. Amanda's official title was Vice President of Strategic Regulatory Initiatives. It was a fabricated position that paid $290,000 annually. She spent her first months attending conferences and building relationships with what she called key opinion leaders. "Why do we need such extensive documentation?" she asked during one compliance review. "Can't we streamline the FDA process with better relationships?" she suggested during another. As if the federal government operated on charm. The regulatory team learned to nod and document everything she said. "I learned to keep meticulous records of every interaction." Then Patricia decided Amanda needed operational experience. She assigned Amanda to shadow me for 4 months. Learning regulatory affairs. Amanda arrived late to morning briefings consistently. She treated our compliance protocols as bureaucratic obstacles rather than legal requirements. She would interrupt technical explanations about FDA regulations to share anecdotes about healthcare innovation panels she'd attended. "This reminds me of something I heard at Davos," she'd say, before describing something completely unrelated to actual regulatory compliance. But Amanda excelled at one crucial skill. She was exceptional at managing upward. She knew exactly when to appear in Patricia's office with morning coffee. She knew how to position herself in photos during investor presentations. She knew how to associate herself with regulatory wins without understanding what created them. After a particularly successful product launch, Patricia sent a company-wide announcement crediting Amanda's innovative regulatory strategy. Amanda hadn't written a single submission section. She hadn't managed a single FDA meeting. She hadn't resolved a single compliance finding. But she'd been present when I presented our approval timeline to the executive team. The announcement came at Nexus's annual leadership summit. The Fairmont Copley Plaza, Grand Ballroom, 400 people, including board members, major investors, and senior medical directors. Patricia stood at a podium beneath screens displaying our regulatory metrics. FDA approval cycle reduced from 23 months to 11 months. Manufacturing compliance rating improved from 68% to 97%. 0 regulatory delays in 14 consecutive months. Patient access to medications accelerated by an average of 8 months. I want to recognize Dr. Sarah Okonkwo for her exceptional contributions this year, Patricia said, her voice carrying that practiced warmth she used with investors. Her regulatory expertise brought us back from the brink. The applause was polite, professional, the sound of people sensing there was more to come. But as we expand into gene therapy and personalized medicine, Patricia continued, we need leadership that bridges regulatory science with strategic vision and stakeholder engagement. I was standing near the back with the regulatory affairs team, the people who actually wrote the submissions, the specialists who prepared for inspections at midnight, the documentation coordinators who'd spent months implementing my systems while research scientists got the glory. They knew what was coming before Patricia said it, which is why I'm delighted to announce that Amanda Carmichael will assume the role of Chief Regulatory Officer, effective next Monday. The applause grew stronger, more enthusiastic. Amanda walked to the stage in her emerald suit. She embraced Patricia with perfect emotional calibration. Her expression conveyed humility, determination, and readiness. Behind them, the screen showed my work. Every metric represented my systems. Every improvement reflected my strategy. My name appeared on no slides. I set down my water glass and left the ballroom. Through the marble lobby, past the executives networking over champagne, past the investors congratulating Patricia. Nobody stopped me. Nobody asked where I was going. I took a cab directly to Patricia's office at Nexus. I had security clearance. The building was empty on a Saturday evening. Patricia was in her office, having left the summit early. Her suit jacket hung on a coat stand. She was drinking white wine, looking satisfied. "Sarah," she said, noticing me in the doorway. Her tone was warm, almost maternal. "Wonderful event. You should feel proud. You've built something truly remarkable here. You promised me the CRO position if I delivered results," I said. "And you have delivered," Patricia replied smoothly. She gestured toward the gift box on her desk. "The spa voucher. You'll remain absolutely essential to our continued success." "Essential but not chief," I said. "Amanda brings different strengths," Patricia explained. "She has relationships with the patient advocacy community. She understands the political landscape. You're brilliant at regulatory science, Sarah, but she has the profile that the board wants to see representing us publicly. She doesn't understand the difference between a 510K and an NDA," I said flatly. "She'll learn the technical details. She has excellent judgment." "Excellent judgment doesn't satisfy FDA inspectors." Patricia sighed like I was being difficult. "This isn't about diminishing your expertise. It's about positioning Nexus for our next growth phase. Amanda is family. That continuity matters to our board and investors. So my 17 years and actual regulatory expertise are less valuable than a last name," I said. "That's not fair. Sarah, you're invaluable, but Amanda represents the future. She'll rely heavily on your guidance." "Rely on my guidance while holding my title," I said. "You'll be Senior Director of Regulatory Operations." Patricia Gozasul, "It's a critical role. It's a demotion. It's a recognition of your strengths. Amanda will handle strategy and stakeholder relations. You'll focus on what you do best. The technical regulatory work." I nodded once. I didn't argue. I didn't let my voice rise. "I understand," I said quietly. Patricia looked relieved. "Good. Take the weekend. Enjoy that spa day. Monday we'll discuss transition planning." "Of course," I said. I left her office. I drove back to my apartment in Brookline. I poured myself bourbon and opened my laptop. Now, before I continue this story, let me just pause here. If you're enjoying watching privilege collide with regulatory reality, hit that subscribe button, because what happens next is a case study in compliance-based consequences. Back to Patricia. That night, I reviewed the services agreement between Okonkwo Regulatory Solutions and Nexus Therapeutics. I read Schedule C, paragraph 8 6 times to ensure I understood every word. Then I composed an email to Nexus's legal counsel. The email was professional and precise. It notified them that effective Monday morning, per the terms of our agreement, I would be implementing access restrictions on Okonkwo Regulatory Solutions compliance management systems pending contract renegotiation. No threats, no ultimatums, simply contractual notification. I sent it at 10 p.m. on Saturday night. Then I logged into the administrative portal for Okonkwo Regulatory Solutions. The infrastructure I'd built wasn't just software. It was the complete regulatory nervous system of Nexus Therapeutics. Every FDA submission was drafted and tracked in my systems. Every manufacturing batch record was stored in my databases. Every adverse event report was logged through my platforms. Every inspection preparation document lived in my document management system. I had designed it as an integrated ecosystem intentionally, not for leverage, initially, but because pharmaceutical compliance requires absolute consistency across every regulatory touchpoint. Now that architecture served an additional purpose, at 7 a.m. Monday morning, I changed the system status from full production access to audit-only mode. In audit-only mode, users could view existing documents but couldn't create or modify anything. They couldn't draft new submissions. They couldn't update quality records. They couldn't log new adverse events. They couldn't prepare inspection responses. They could see historical data, but couldn't document current operations. At 8 a.m., 346 Nexus employees tried to access their regulatory systems to begin their workday. None of them could work. The submission writers couldn't open new filing templates. Error message. System access restricted. Contact regulatory administrator. The quality assurance team couldn't update manufacturing records. The safety team couldn't enter adverse event reports into the FDA reporting system. The inspection readiness team couldn't access preparation protocols. By 8:30, the regulatory affairs help desk was overwhelmed. By 9 a.m., someone realized they had 2 FDA submissions due that week and couldn't access the files. By 9:30, Amanda Carmichael, new Chief Regulatory Officer, was standing in the Regulatory Affairs Department trying to understand why nothing worked. "Just override it," she told the senior regulatory specialist. "We can't," the specialist replied, visibly stressed. "All our compliance systems run through Dr. Okonkwo's infrastructure. We only have operational licenses. We don't have administrative control." "What do you mean we don't have control?" Amanda demanded. "We're Nexus Therapeutics. These are our regulatory systems. They're Dr. Okonkwo's systems," another specialist explained carefully. "We license them. She owns the infrastructure, the databases, the submission templates, everything." Amanda stared at them like they were speaking another language. "That's impossible. We wouldn't build our entire regulatory operation on someone else's proprietary platform." "We didn't build it," the senior specialist said quietly. "Dr. Okonkwo built it. We just use it." Amanda's face went from confused to angry to pale. "Get Patricia. Immediately." Patricia arrived at the regulatory department 45 minutes later. She'd been on a call with board members. Her expression was controlled, but her jaw was tight. She looked like someone watching their career implode in slow motion. "Explain this situation," she said coldly. The regulatory team pulled up the services agreement on screen. They showed her the system dependencies. They explained how every compliance function at Nexus relied on infrastructure that Dr. Sarah Okonkwo controlled. Patricia read Schedule C, Paragraph 8. Her face went rigid. Then she pulled out her phone and called me. I was at a coffee shop in Brookline. I saw Patricia's name on my screen. I let it go to voicemail. She called again. Voicemail. The 4th time. I answered. "Sarah." Patricia's voice was strained, carefully controlled. "We need to discuss this access issue." "There's no issue," I said calmly. "Everything is functioning exactly as specified in our contract." "Nothing is functioning. My teams can't access critical systems. We have FDA deadlines this week." "Your teams have full audit access to existing documents," I corrected. "Per Schedule C, Paragraph 8, when my position was materially restructured without proper notice, access restrictions automatically applied." "Sarah, this is unprofessional. You're jeopardizing patient safety." "I'm exercising contractual rights," I said. "You restructured my authority. The agreement specifies the consequences. This is blackmail. This is business. You taught me that Saturday night. Silence on the line. I could hear voices in the background. Someone was telling Patricia that 2 submissions were due to the FDA in 3 days. What do you want? Patricia asked finally. I want a new agreement, I said. 8-year term, complete authority over all regulatory affairs. My Chief Regulatory Officer title restored with board approval required for any changes. And the licensing fee for Okonkwo. Regulatory Solutions increases to $975,000 annually. The previous fee had been $320,000. I tripled it. That's absurd, Herr Assistant, Patricia said. That's the cost of your entire compliance infrastructure being non-functional, I replied. You have 4 FDA submissions due this month. You have 2 facilities scheduled for inspection next week. You have adverse event reports that must be filed within 24 hours by law. How much does each day of non-compliance cost you? Sarah, be reasonable. I am being reasonable. I'm offering you a solution. You can accept my terms, or you can spend the next 2 years rebuilding regulatory systems from scratch, while the FDA shuts down your manufacturing and your pipeline dies. Your choice? Patricia was silent. I could hear her breathing, thinking, calculating consequences. I need to discuss this with the board, she said finally. You have until 5 p.m. I said, after that, my fee increases to $1.3 million annually. I ended the call. I ordered another coffee. I checked my email. Amanda had sent me 11 messages, each progressively more frantic. Please call. We need your help. This is affecting patient care. Sarah, please respond. I didn't reply. At 4:40 p.m., 20 minutes before my deadline, Patricia called back. We accept your terms, she said. Her voice was hollow, defeated. I'll need it in writing, I said. Full contract executed by the board before I restore access. Legal is finalizing it now. Send it to my attorney for review. Sarah, Amanda made a mistake. I made a mistake. Can we move forward professionally? We can move forward, I said, on my terms. The contract arrived at 6 p.m. My attorney reviewed it thoroughly. 8-year term with automatic renewal provisions. $975,000 annual licensing fee with escalation clauses. Complete operational authority over regulatory affairs. Chief Regulatory Officer title with explicit provision that removal required board unanimous vote and 90 days notice. I signed it at 6:45 p.m. I restored full system access at 6:50 p.m. Nexus's compliance systems came back online. Submission writers could suddenly draft again. Quality teams could update records. Safety specialists could log adverse events. Inspection teams could access protocols. It was instantaneous. Amanda Carmichael retained her title of Chief Regulatory Officer for exactly 11 days. Then she was quietly reassigned to a newly created position called Senior Vice President of Patient Engagement. In practice, she became a spokesperson for patient advocacy events. Patricia never apologized. She sent one email acknowledging the revised organizational structure and thanking me for ensuring regulatory continuity. 6 months later, Amanda left Nexus to join a healthcare foundation. Her LinkedIn profile described her time as CRO as leading regulatory transformation. I didn't correct it. The FDA filings spoke for themselves. The regulatory team knew the truth. The quality specialists knew who actually managed compliance. The FDA inspectors knew whose name was on every submission. Patricia knew. She just never spoke of it again. 20 months later, Nexus Therapeutics was acquired by a major pharmaceutical company for $3.8 billion. The acquiring company specifically cited exemplary regulatory compliance and robust submission infrastructure as key value drivers. Patricia personally received $460 million from the sale. I received my licensing fees, plus a retention package that the acquiring company insisted on as part of the transaction. They wanted assurance I would stay. I signed a new contract with the acquiring company, similar terms, higher fees, extended duration. They understood what Patricia learned through crisis. Some people are replaceable. Some regulatory infrastructure is not. And the person who builds the compliance systems that keep your company from FDA shutdown is never just a consultant. I'm still with the company, still building systems, still managing regulatory affairs. But now when executives discuss succession planning and family leadership, they do it carefully. They remember what happens when you replace the compliance expert with someone who can't distinguish a clinical trial phase. The last time I saw Patricia was at the acquisition closing. She shook my hand and thanked me for agreeing to continue. "You always were exceptional at regulatory affairs," she said. "Regulatory affairs isn't optional," I replied. "It's the difference between operating and being shut down." She had no response. I walked out of that conference room with a contract that made me functionally irreplaceable for 8 years. My compliance systems weren't just protecting patient safety anymore. They were protecting my authority. That's the essential truth about pharmaceutical compliance. If you architect it correctly, the system becomes inseparable from the person who designed it. And if someone tries to remove you, the entire regulatory framework freezes. Patricia learned that lesson at 8 a.m. on a Monday morning when her entire operation went into audit-only mode. Amanda learned it when she discovered her impressive title came with zero actual regulatory control. I didn't need to destroy anything. I just needed to restrict access. Sometimes revenge isn't emotional. Sometimes it's just enforcing a contract clause that was always there. And sometimes the most powerful system isn't one that documents compliance. It's one that ensures nobody can operate without you. Thanks for listening. Hit subscribe unless you want to learn the hard way what happens when you replace the person who keeps you from FDA shutdown. Trust me, regulatory consequences are expensive.